My name's Helen Carty and I'm a Veterinary Investigation Officer from Scotland's Rural College, SRUC. Within SRUC we deliver farm animal surveillance on behalf of the Scottish Government, and so we work really closely with farm animal vets in practice, helping them investigate disease outbreaks on their clients' farms. And really the reason we do that is so that we can help with investigating the normal disease outbreaks, the outbreaks of endemic disease that we know about, but also so that if something new happens, if something out of the ordinary happens, if something unexpected happens that could be a threat to animal health or indeed a threat to human health, that we find out about it quickly. So it's really about networks communicating with people and trying to pick up on alerts as soon as they happen. At the farmer level, we can give really useful information back by carrying out disease investigations, doing testing or doing post-mortem examinations. We can inform that individual farmer's flock and herd health plan. But from a national point of view, if we can put all that information together, we can spot trends. So if diseases are happening earlier in the year or later in the year, we will pick up on that. Or if there's something brand new that we've not seen in the country, we'll pick up on that. So it can really, we can feed that back to other farmers in the local area or further afield as appropriate. I mean, there's loads of things we can be looking out for, but folk who've got sheep are thinking about getting the ewes ready, getting the tups ready. And if you're going through your ewes and there are ones that are thinner, it might be worth just particularly looking at them and using them as an opportunity to screen for iceberg diseases. So we're aware that conditions such as Johne's disease or OPA or Myri-Visna can cause ill thrift in ewes. So if you've got cull ewes, cast ewes that are not going back to the tup, that you're struggling to get a condition on, you've checked their teeth, there's not obviously any teeth problems or foot problems or other problems, then speak to your vet because it might well be worth doing some testing on them. And many farmers, what they'll choose to do is post-mortem examinations on, say, a batch of 4 of those ewes, just to use them to screen to see if any of these iceberg diseases are present. So it's a really useful tool that can be done at this sort of time of year. So Haemonchus is a stomach worm that sheep get, and it's sort of one of the most significant parasites in the southern hemisphere. So when I was at university many years ago, it was associated as being more of a tropical parasite. But in recent years, say in the last 20 years, there's been lots of cases in England and Wales, but in recent years it's seemed to have crept further north as well. So it's a worm that sheep get. Sheep can get lots of different worms, but the difference with this worm is that even a small number of the worms can cause quite a loss in production. Because it's a worm that lives in the stomach and it sucks blood, it can make animals anemic, infected animals anemic. They can lose condition. They might develop a bottle jaw. They're less likely to have diarrhoea. Most other gut worms will cause diarrhoea, but they're less likely to have diarrhoea. Over the summer months, we've had probably more cases of Haemonchus diagnosed than we have in previous years, and actually up in the northeast of Scotland we've had quite a few diagnoses of it as well. It's important to understand what worm species your sheep are infected with so that we can make sure that the right treatments are given. It's also important to check that if you're using any wormers, that those products are working, because this parasite, there's the potential that there could be resistance to certain wormer products. So it's one to be aware of, that if sheep are looking pale or seeming weak and they've got worm eggs there, an extra test can be done to see if those worm eggs are Haemonchus eggs. Then you can work out the best course of action with your vet.